And here is your question. Right. So if you have read and understood, considering it surgical pathology station, kindly tell me, since this patient is a known case of sickle cell disease, what exactly is sickle cell disease?
Yes, sickle cell disease is a hereditary hemoglobinopathy in which there is polymerization of the deoxygenated hemoglobin that will lead to red cell distortion and vaso-occlusive crisis and chronic organ ischemia. And there is a point mutation in the beta globin chain. Uh, uh, there will be replacement of the valine for the glutamic acid on the
Yes.
short term of the chromosome 5.
5 or at
Uh,
what level? 6.
uh, 6.
So what exactly has happened?
So there is point mutation of
Yes.
valine from the glutamic acid.
Yes. Okay. And what type of hemoglobin do they carry or possess?
Uh, yes, they carry hemoglobin S.
Right. Hemoglobin S. So a patient with sickle cell condition normally presents in accident and emergency department with what kind of sign and symptoms?
Uh, they usually come with the vaso-occlusive crisis or severe pain in the
Severe
back or
pain.
joints
Yes.
and some ischemic symptoms to the organs.
Yes. In that situation, if hemoglobin is done, what exactly should be the range, which is normal for patients with sickle cell condition?
I'm not sure about that.
Okay. So, right. Right. Can you tell me, in this condition, all of a sudden, your patient has arrived because of road traffic accident, and now that a new discovery is 3.9 centimeter temporal region mass. So what is the significance, surgical significance of knowing the mass and associated with sickle cell condition? Why is
Uh,
it important for you as a surgeon to know about this?
yes, the patient could have been having the background anemia, or she could have uh, vaso-occlusive crisis simultaneously because both the body is in the stressful condition. So we can expect the body could be in some kind of a stress and vaso-occlusive crisis has been going on. So other than that, there could be liver failure, pulmonary hypertension along with that.
Very good. What do you understand by the term sickling complication? What happens
Yeah.
that condition?
As we have already known that due to red cell distortion, the shape of cells has been changed and there is red cell distortion. So they might get stuck in the normal vasculature and they can stuck in the splenic sinusoids. So due to chronic retention of these cells into the splenic sinusoid, the organ can become enlarged and recurrent inflammation and ischemia can go simultaneously.
All right. While managing a patient with sickle cell condition, what are the things that you have to keep in your mind?
Yes, the management should be according to the care of critically ill surgical patient protocol.
Yes.
And according to that, we follow the ABCDE approach. Uh, we should give the patient 100% oxygen for the better oxygenation and perfusion of the organs.
Yes.
And we should prevent the dehydration and the state of acidosis.
Yes.
to better manage the patient and to take the patient out of stress.
And manage and control patient's pain. And what about the tourniquets?
Yes,
You have
tourniquets
to
should.
use them with caution. Why?
So
We can come back to this question later. All right. Can you please tell me why do the patients with sickle cell disease present with are normally immunocompromised?
because the spleen because of this patient there is the risk of autosplenectomy, and when there is no spleen, so they are at high risk of having infection with the encapsulated organisms.
Okay, presenting this 66 years old patient with a mass in temporal region could be a coincidence, or is it like associated with the sickle cell disease? Or in other words, what are the most common primary brain tumors in elderly patients?
Yes, the primary brain tumors could be primary brain tumors and secondary brain tumors. In
Good.
the primary brain tumors, it could be high-grade brain tumors and low-grade brain tumors.
Yes.
The high-grade brain tumors includes glioma, glioblastoma, and medulloblastoma. And in low-grade tumors, it could be meningiomas, acoustic neuromas, neurofibromas, pineal gland tumors, pituitary adenomas, and craniopharyngiomas. And the secondary brain tumors could be metastatic from any other side.
Good. Can you please tell me the pathological manifestations of these brain tumors?
Yes, brain tumors can manifest in various symptoms depending onto their location, but the general symptoms could be headache, visual disturbances, nausea, vomiting, and seizures. And focal neurological deficits can be there according to the location of the tumors. For example, if the tumor is in frontal lobe, the patient can present with the personality changes. And if it is in the parietal lobe, the patient can present with the dysarthria and speech problems.
Okay. Just suppose you decide to leave the mass in this lady. What are the consequences that you should be prepared for?
It can carry a high risk of mortality,
Good.
and death would be inevitable.
Yes, good. So just suppose you went ahead and you did the biopsy, and the result came back after 2 weeks, and it shows that patient is suffering from squamous cell carcinoma with keratinization. So what is the relevance of knowing this biopsy report?
That means that it is this is the metastatic tumor, and
Yes.
the primary origin is somewhere else.
Yes.
And it could be in the squamous cell carcinoma of the nasopharynx, esophagus, skin, or lungs.
Okay, good. So you went ahead and you decided, and you, after discussing with your MDT team, you have excised the lesion. Post excision, patient wound is not healing. What might be the common organism that you'll find there?
The Staph aureus could be there.
Yes. Okay, and there is a fluid discharge from the wound, and that contains the glucose. What might be this, the significance of knowing this, that the fluid is containing glucose?
Yes, that means there is direct communication with the cerebrospinal fluid.
All right, right. Just 16 seconds left. Okay, why the patients with sickle cell condition experiences joint inflammations and joint pains?
It's again due to vasoconstriction crisis. There will be avascular necrosis and osteomyelitis. So, because of the poor perfusion, there is high chance and high risk for the infections of the bones and the joints.
Good. And because of that, there'll be obstruction in the circulation because of the sickling of the RBCs. So that also leads to ischemia and pain. Pain is because of ischemia.
Yes, ma'am.
Good. Good. Thank you.